last year medical student studying at Sri Chamundeshwari Medical College, guided and mentored by Dr. Rohini ma'am from the anatomy department here. Today our topic is the right and left lung and differences between them. The lungs are the pair of respiratory organs lying in the thoracic cavity and enclosed within the pleura, and it lies on either side of the mediastinum. It has an apex. This is the apex of the lung. It has a base. The apex projects into the neck and it is limited upwards by the Simpson's fascia. The Simpson's fascia arises from the transverse process of the C7 vertebrae and it gets attached to the inner border of the first rib and its costal cartilages. It separates the subclavian artery, vein and the first rib from the apex of the lung and its cervical pleura. Now, the lung has three borders, which is the anterior border, which is the sharpest border, and it is facing towards the heart. This is the posterior border and it is ill-defined. It is thick and it is blunt, and it has an inferior border. The inferior border lies on the diaphragm. So, if we hold in such a way that the apex lies superiorly, the base is inferiorly, the anterior border is forward and the posterior border is backwards, this is the side determination of the lungs. Now, let's look at the differences between the right and the left lung. So, this is the right lung and this is the left lung. We can see that the right lung is thicker and broader than the left lung. The right lung weighs near about some 700 grams, whereas the left lung weighs 50 to 100 grams lower than the right lung. The left lung is longer and narrower than the right lung. We can see that the right lung is divided into three lobes, that is the upper lobe, the middle lobe and the lower lobe by two fissures, which is the oblique fissure, which you can see over here, and the horizontal fissure. The left lung is divided into two lobes, which is the upper lobe and the lower lobe by the oblique fissure. The fissure which is common to both of the lungs is the oblique fissure. This is the medial surface of the lung here, we can see, and this is the left lung and this is the right lung. We know that the heart is present within the mediastinum and it is tilted towards the left. So, in the left lung, we can see a notch over here. This notch is known as the cardiac notch, whereas in the right lung there is no cardiac notch present and the anterior border is nearly straight here. Due to the presence of cardiac notch in the left lung, there is a tongue-like projection. This tongue-like projection is known as the lingula. And over here, this is the hilum part of the lung from where the structures enter the lung and leave the lung. We can see that this is the trachea. And this is entering the lung, and there is only one principal bronchus which is entering the lung here. Whereas in the right lung, what happens is the principal bronchi divides into the lobar bronchi before it enters to the right lung. Thus, there is presence of the epartial bronchi and the hypartial bronchi. And in the left lung, there are two bronchial arteries, whereas in the right lung, there is presence of only one bronchial artery over here.